right, I'd now like to welcome to the stage Dr. Deb Howry. She will introduce our speaker, Dr. Mandy Cohen, before leading us in a conversation about the heart of disease control in Atlanta. So Deb is the Chief Medical Officer and Deputy Director for Program and Science for the Centers for Disease Control and Prevention. She has previously served as the Acting Principal Deputy Director and the Director of the National Center for Injury Prevention and Control. What a resource to have in our club. Dr. Howry has participated on numerous public health boards and committees and is an alum of Leadership Atlanta and the Hedwig Van American Executive Leadership in Academic Medicine programs. She has authored more than 100 peer-reviewed publications, is a member of the National Academy of Medicine, and has received numerous awards throughout her career, including the APHA J. Drotman Award, U.S. Department of Health and Human Services Group Award for the Service to America, and the AMA Award for Outstanding Government Service. We are so pleased that you will be able to lead us in this discussion, so welcome to Deb.
Well, thank you. It's so great to be here and see so many people. It's my honor and pleasure to welcome my boss, Dr. Mandy Cohen here. She is the Director of the Centers for Disease Control and Prevention and the Administrator of the Agency for Toxic Substances and Disease Registry. So, in this role, she is truly one of the nation's top health leaders with experience leading large and complex organizations and a proven track record of protecting Americans' health and safety. And I can truly attest to this for when she came on board and has led us post-COVID really on many different epidemics at this time, things like Mpox, what we're seeing now with Marburg. She has just really taken charge of the agency with her vision, very data and action focused. She's an internal medicine physician, and she also led the North Carolina Department of Health and Human Services. We were talking at lunch, how she's traded one emergency, for another. And when she was in North Carolina, she was really lauded for the work she did in the COVID crisis with over 100 media briefings she did, just really making it a safe, action-oriented, really showing a lot of progress in that state around COVID in a very bipartisan fashion. She also transformed the North Carolina Medicaid program through the state's Medicaid expansion and our focus on whole person health with the launch of the country's first statewide coordination platform. She also served as the Chief Operating Officer and Chief of Staff for Centers for Medicare and Medicaid Services and the Acting Director for the Center for Consumer Information and Insurance Oversight. Also many, many awards, including Modern Healthcare named her as one of the top 25 women leaders in healthcare. She received the Leadership and Public Health Practice Award from Harvard. And she also was the Tar Heel of the Year for her work for COVID. As Georgia people here will let you have that. So, and she was also elected to the National Academy of Medicine, and she is married with 2 lovely daughters. So we are so excited to have you here today, Dr. Cohen.
Well, hello.
And you'll find this is not a shy crowd. But the first question I'll start off with is just, you've been at the CDC for over a year. It probably feels like 10 years sometimes. But what would you say? Move the microphone a little closer? Perfect. What would you say are some of your proudest achievements in this past year?
Well, first, Deb, wonderful to share the stage with you. You all are so lucky to have Dr. Howry as a member of the club. She not only is a national leader, but she is the biggest champion for Atlanta that I've ever seen. And so making sure that I'm learning from her as I joined this role. And as you may know, but I have to just say about CDC, I didn't know this, I think, when I joined. CDC is the only agency that is based outside of DC. So being in Atlanta is quite unique as a federal agency. We have more than 10,000 folks who live and work here in the Atlanta area. 66% of them, 2/3, have a master's degree or higher. And if you turned our budget and our economic footprint into a publicly traded company, we'd be in the top 5 of the companies here in Atlanta. So I think I share that as an opening to say, I want to make sure that the Atlanta community knows CDC, is proud of CDC, and can continue to support the work that CDC does, not just for, obviously, Atlanta and Georgia, but for the country and really the world. So I'm appreciative of the opportunity to sort of be here to talk about the way in which I think CDC is different. Frankly, we are all different after the pandemic. We've all learned a lot of things, and CDC had to learn a lot of hard lessons. And I was lucky enough to pick up the baton about 15 months ago to say, well, how do we think about this historic moment that we just had, and what do we need to do to be different? And so we've been on a journey to really think about how the organization can be the public health response agency that the country and the world really needs. And there's been tremendous amount of work to make sure we're embedding those lessons. And the thing I'm probably most proud of is the way that there's two. One is the way that we're communicating differently. So much of public health is in the communication. How do we communicate quickly, but in a concise and clear manner? And that takes a lot of hard work to boil down a lot of potential nuance and scientific detail into something that's actionable and easy to understand for folks who aren't swimming in public health every day. So I hope you're noticing a difference. It's the thing I think the reason I have my job is to really think about the communications. But the other reason I think I have my job is to think about how organizations perform. And CDC, rightly so, over many, many years, had built up our capacity focused on diseases. If something's going wrong with Mpox or with malaria or HIV or COVID or flu, we respond. But it means that we have these very expert teams who are focused on a particular germ or a particular health threat. But what we unfortunately didn't do as much as we needed to is invest in a way that is disease agnostic, so that we have the capacity to respond no matter the threat, so that when something new that we've never seen before happens, like COVID, and it happens quickly, we didn't have that ability to pivot as quickly as we needed to be. So we didn't have the data systems, the laboratory capacity, the testing, all the things that we've all, as armchair experts we became over the pandemic, the things that we needed on day one. And so what we've been doing is trying to think differently. How do we operate as one team so that we are building capacity in data, in our laboratories, in our workforce, in our response capabilities, so that we can be ready no matter the disease threat. So if we have new cases of Ebola, which are happening in Rwanda right now, over the weekend, it's always on the weekend, that we are ready to respond. We already actually have teams on the ground in Rwanda, for example, and we're deploying 3 more. But we have data systems, we have laboratory capacity, and we can pivot those resources to be able to be what the country and what the world needs, no matter what. So communication and probably the infrastructure to be able to respond are the things I'm most proud of, that I think CDC has come such a long way in learning those really important lessons from the pandemic.
One of the other things that really impressed me was literally day one, you set priorities. And you did open it up to the leadership team and really to the agency to help fine tune them, but it wasn't like a 6-month long planning process. It's like, let's set some priorities and really see how we can involve everybody in the agency. Tell us a little bit about those.
Well, I'm looking at a room full of leaders that know how important it is to prioritize. There's only so many hours in the day and so many dollars in the bank account, and if we're not focused, then we aren't going to move the needle. And I did a lot of homework before I took the job at CDC to figure out where were the right places to focus, what were the things we needed, and then obviously work with the leadership team. But particularly when you take these jobs in federal service, you have an incredible sense of urgency. there's something happening in the first couple weeks of November, you may hear, that may change whether or not I get to keep my job, so I have a real sense of urgency. And so on day one, really important to articulate what we wanted to focus on, and importantly also how to do that work together. So to communicate differently and to do our work as an organization differently. But we focused on 3 things, and I shared these 3 in the very first all-staff meeting that we had with the organization, and they've really held. And we're actually going to continue them into 2025. So the first priority is not surprising. It's the table stakes things that CDC has to do to be what it needs, which is to be ready to respond, right? So how do we make sure that we as an organization are ready to respond to whatever the health threat? And that health threat could be an infectious disease, or it can be a non-infectious disease, but that we are ready. So for example, one of those non-infectious disease was the heat. Right, we've had 2 of the hottest years on record, and heat impacts your health. So how do we use our data, our lab, right, our response capability to make sure we're protecting health through a hot summer? Or on the other side of the coin, turns out we still have COVID around, and flu, and RSV. How do we make sure we're ready to prevent the 800,000 hospitalizations we saw last year from COVID, flu, and RSV? So ready to respond no matter what. But then the second priority was understanding that coming out of a historic pandemic, we were continuing to see challenges in our mental health. We are seeing more suicides and unfortunately more fatal overdoses. So we made a second priority a focus on improving mental health, particularly reducing suicides, reducing overdoses. This is Deb's area of focus, has been building that infrastructure for years, and we were able to sort of take it to the next level and shine a spotlight on it. And then the third area of focus was one where we wanted to not just be reactive, right? Response is reactive. Like a problem happens, you can go try to solve it. But to be proactive, prevent, right? And so the third area of focus was supporting young families in their health, right? Because if we want to be the strongest country that we can be economically and productivity-wise, we have to have our health. So, right, we need to think about what is it that builds the healthiest communities and our healthiest country. And we know our lifelong patterns of health are established between 0 and 10. And that starts with mom having a healthy pregnancy, but then our kiddos making sure that they're getting vaccinated, that they are not experiencing adverse childhood experiences, that they are access to healthy food. So how do we think about those early childhood experiences from a prevention perspective? But it's also about mom and dad, right? Are mom and dad preventing diabetes? Are they quitting smoking? The things that still kill folks here in the United States, 1, 2, and 3, heart disease, stroke, cancer, right? So how do we think about those from a preventative perspective? So those are our priorities: be able to respond, improve our mental health, and be proactive, particularly thinking about supporting young families.
So thinking about preparedness, and I always love when you say we can prepare for fall and winter because we know it comes every year. How do you suggest that we, as a group here, really prepare for fall and winter?
Well, I want to thank Rotary for having just a truly historic emphasis on vaccines, and I really appreciate that. Again, it's the preventive, proactive thing we can do. We're going to be ready with hospitalizations, and our ERs are going to be open, we're going to have treatment for folks, and we're going to save as many lives as we can. But I love the focus on the prevention piece and the vaccine piece, and Rotary has been such a leader. Actually, before I get to fall, winter, I do want to congratulate Rotary for the incredible investment in the polio space, particularly that they've done on the eradication of polio internationally. We are very close. There's more and more work to do to get over the final finish line to eradicate polio from the world, which would be an amazing feat. And I was so proud to see Rotary at the table in every one of these calls that I am on, really thinking about making sure the resources are used well and effectively, but just pushing us forward at every point. So Rotary's been a great partner, particularly on polio. But as we think about fall and winter, we are in a time, I think, coming out of the pandemic where there is decreased trust, more skepticism in vaccines, and we see it in the numbers. Less people are now even not getting their flu shot. But it's not dire, but we cannot let it slip further, and we cannot make preventative health measures political. We have to make sure that we are focused on the fact that these are the best defense we have against some bugs that can really hurt folks, particularly those who are over 65 and our kiddos under 5. So you're going to hear a lot from us. And we've been working really hard, not just on the communication. That's important. So you'll hear a lot of messages, and I'm certainly recommending things. But what I'm proud of that the CDC is really focused on for this season is the operations, right? What does it take to get everyone a flu shot in this country? What does it take to get everyone a COVID shot, right? It has to be convenient. It's got to be at a price point that everyone can afford, right? We've got to combat stigma and misinformation. So we're really focused on how do we think about every step someone takes over the next couple of months in their interaction with healthcare? Maybe they're at a pharmacy, maybe they go to their primary care doc, maybe they're going to their specialist. How do we think about embedding in the workflow the fact that you need to get your vaccine? The number one reason people say they didn't get vaccinated last year wasn't because they didn't believe in vaccines. They said it was because their doctor didn't bring it up. They didn't recommend it. So they just assumed, oh, I'm good, right? I'm not really at risk. Even for those who are over 65, who definitely are at the highest risk. So how do we think about embedding that in workflow? So it does come up at every visit, whether it's a pharmacy visit or a primary care doctor visit, and that takes technology and data. And so that's what I'm really proud of CDC working this year. Now, we have more work to do, but we're not just saying, please get a vaccine. We're saying, let's make it easy for you to get the vaccine.
So President Adrian would be remiss if I didn't ask one last question before people want to start lining up, and that would be, what is really the call to action, or what can Rotarians do in partnership with CDC?
Yeah, we need your help. Protecting health and improving lives is the mission of CDC, and that is a huge mission, and we all saw during the pandemic that is not a mission that can be carried out by CDC alone, right? Protecting health and improving lives is a joint effort here, and I want to appreciate how much work from the private sector, the business community, I saw in North Carolina firsthand in order for us to get to the other side of that. I don't want to forget all of that effort and all of those relationships that were built. So easy things. So for any of you, for example, who still have flu shot clinics at for your employees, add a COVID shot. There's no reason why we shouldn't be doing COVID and flu. You line them up side by side, COVID still kills and hospitalizes more people than flu. So let's do both. You can get them both on the same day, right? Things like that, where we're thinking about the operations, I hope you can too. I think the other part is to just be a voice in the community of saying, how do we protect the health of this community together? I think it's going to take work from all of us to combat misinformation, to rebuild the credibility of public health. We're trying to do our part, and I hope you hear that. We own that, and we have work to do, but then I want folks like y'all to recognize that we're doing that hard work and to help us carry that message forward and make sure that we are not further eroding trust. And none of us is immune to this. We see erosion of trust in academia, in the media, in other institutions. And so I do think there needs to be collective effort on thinking about how we are maintaining trust in science, in the media, in academia as we go forward, to make sure that we can be the healthiest, strongest country that we possibly can be.
Thank you for that. That call to action speaks to the four-way test that we all live or try to live up to at Rotary. So thank you for your leadership. Let's open it up to the floor if anybody has questions. David, you go first, please, and then Randall.
One of our former members, Mark Rosenberg, was the head of the ill-fated attempt at CDC to research the issues of gun violence and their impact on health. We had the head of trauma department from Grady here last week, and he said that guns are the largest source of death for young people these days, and we know the impact of guns on the suicide rate as compared to any other country in the world. How do you manage the politics of that extraordinary issue in public health? Because it's not easy.
Sure. Maybe I'll tell you a slightly different story so you know how I approach. Sometimes you don't go to the tip of the hardest problem right first. And that is some of the place where there is a lot of, there are a lot of politics in that space. And so when I first joined Governor Cooper's team in North Carolina, we also wanted to do a couple of really hard things, but we didn't do the hardest thing first. We start with some things where we see a lot of consensus, where we can accomplish something together, build trust back potentially, and then say, okay, let's take the next step to a slightly harder one and a slightly harder one. And that was a little bit of our blueprint for how we expanded Medicaid in North Carolina in a bipartisan way, right? So I wanted to do that in my very first day. That wasn't going to happen, right? So we had to do things like we worked on the opioid crisis together, then we reformed the Medicaid program together, then we responded to COVID together, and then we were able to get to a conversation to be like, all right, we're ready to do this as a state, and we did it in a bipartisan way. I see it similar now from a gun violence place, right? I'm looking for places where you hear our priorities to focus on things that I continue to hear consensus around politically, and so that so we can have some of these trust-building opportunities on both sides of the aisle, because then I think that allows us to take other steps to be like, okay, we've done some hard things in overdose, for example. Well, let's look at suicide. Well, most of suicides, unfortunately, are the result of gun violence, right? So, okay, we've already talked about our shared priority on reducing suicide. So why don't we talk about gun violence in the context of suicide, where I see a lot of consensus. So that is the way I think about the politics. Find the consensus, take a step, and then take the next step. So it means that CDC is doing research to make sure that, in the confines of what Congress has given us the authority to do. But I think that is our ability to then take the next step to say, look, if our mission is to protect health, look who's dying. How do we take the next step there? But I think we have to work on some of these other fundamental pieces, like being ready to respond to any health threat, to thinking about this totality of improving mental health. So that's the way I'm thinking about it. But Deb is really the expert here. Maybe you want to jump in.
The only other thing I was going to do is a bit of Georgia trivia, and that was Senator Isaacson, right before he retired, actually defended and supported the CDC to do firearms work. And he had an A+ from the NRA. And so I think it's finding those champions that can speak about why it's not political. And I'm an ER doc, so for me it's about saving lives. And so if you can just focus it on saving lives, and like Mandy was saying, working on not the hardest things first, but finding those partners. And like with Senator Isaacson, it was around school shootings and suicide and protecting our veterans. We found those common interests and were able to start building work at CDC.
Go ahead, thank you.
Yep. Hi, Helene Gale, Spelman College, but also on the CDC Directors Advisory Committee and 20 years at CDC. So thrilled to have you here. And my question initially was going to be similar to yours, which was, just how you deal with the politics. But I think you talked about that very nicely. It would be great to have you say a little bit about your public-private partnerships and why this group particularly is so important. I found always being at CDC that although Atlanta realized that we were in CDC, Atlanta realized CDC was in Atlanta, it was not always clear that people felt like it was important to show how important the CDC was to Atlanta and really develop that kind of advocacy. So I think, that would be one thing. What can this group of people do to really make a difference? And then I guess the second is just simply, how are you thinking about this increasingly? We used to be really Atlanta, and now people kept, while I was there, people kept saying the distance between Atlanta and DC is shorter and shorter. And I think as CDC has become more part of the political landscape, I think that does make your job harder.
Well, maybe I'll do your second part first, and then I'll go back to what others can do. I think there is both power and disadvantage in being in Atlanta. So I think it's a double-edged sword. I think the power is, one, being able to mobilize different, being embedded in a different community, and the fact that we have that distance allows our experts and our scientists to do their work well. However, there are incredible assets across the U.S. government that we need to coordinate with, and I think you saw some of the downside of us not being in D.C. for that communication during the pandemic. I think we're trying to bridge that gap and get closer, because I do think we have to be one team as we do this work. I say it to our CDC, we have to be one team, but we have to be one U.S. government as we think about response effort. The stockpiles, the vaccines, those live in places outside of CDC. The entire delivery system lives outside of CDC. We're always going to be partnering, so we have to be building that. So I want to make sure CDC is actually a very integral and integrated partner into all of U.S. government, but take advantage of the fact that we are in Atlanta to be able to do our work with maybe not quite so close to the fire. On the what folks can do, I think it's really, really important that we continue to not forget what we learned during the pandemic. And I think what I hope folks have learned is that good public health is good for business. And what I mean by that, when public health is working, it's invisible. Right? The fact that all of us are getting on planes today, we're gathered in this large room, and that our food is safe and our air is clean, yay, public health, thank you so much, right? But it's often invisible, and part of what I'm hoping to also do in the communications is turn that invisible to the visible, just to help folks understand what is the day in and day out work of public health that is keeping folks, allowing us to operate and move in the way that we want to in this, and gather and travel and in all of that. So I think it is recognizing that we know that public health and business are so linked, and so how do you think about incorporating that into what you do and what you advocate for, and what messages you're reinforcing, whether it's for your own employees or with fellow members and other elected officials. So that would be one. Of course, there's very tactical things that you can do related to, like I said, simple thing you can do, like today, call your HR folks and say, are we having a flu clinic? If not, we should, and we should add COVID to it. Then you want to think about what is your healthcare package that you offer to your employees? How are you thinking about preventative health in the context of what you offer to your employees? I think there are a lot of but you have to get involved in the preventative side of things to make sure you are focused on that for your employees. But I think there's a lot to do in that space as well.
And on that, just finally, could you say a little bit about how CDC is approaching the social determinants of health?
Sure. So I think it has now been well established that while we work incredibly hard, and I'm a physician by training, in the healthcare space, that we know 70% of what happens to us from a health perspective is actually determined by what zip code we're in. And so we recognize that there are so many factors that we need to think about as we think about a healthy society overall. And I think this is where employers have a big role to play, and we spent a lot of time in North Carolina thinking about how do we build a healthy state, and one of them was to just have the recognition that businesses play so much of a huge role in our in the health of our communities. One of our biggest hospital systems, self-insured, looked at where their employees, particularly some of their lower wage employees, were living. And it was the same places where they were seeing their sickest patients come from. And what they recognized is they actually raised the wages of their lowest paid employees, again, because they're self-insured, because they knew if they raised their wages, that it would actually come back to them as a benefit to their bottom line in less health outlays in terms of cost. So those are the kinds of things. That's not a CDC, sorry, I'm going to get back to CDC stuff, but I think those are ways in which employers, particularly if you are self-insured, you want to be thinking about, again, what benefits are you offering, what, again, your salary structure, because if it's coming out the other side on the healthcare, are you getting the productivity you want, and are your dollars being used most effectively? For CDC, our job continues to be the same, right? We want to make sure we're surfacing problems and then giving tools, the evidence-based tools to solve them. So what we do around social determinants is just that, is to bring these kinds of stories to light. So use evidence to show what might work, like raising wages, or paying for transportation benefits, or thinking about food benefits as a health intervention, and then making sure that folks have the right data and expertise around that.
Randall, go ahead.
That was a big topic. The next big topic, I was going to ask you about fentanyl. It's hard to ignore that. In the news that came out last week, got a lot of press that maybe there's a little early data saying maybe we're going. My bigger question is this. As a country, we don't love using the law as a public health tool. There are rare exceptions like click it or ticket, seat belts. But most of the time, we haven't done well with law, sort of criminalizing addiction. That doesn't tend to work well. Talk to us about how you think about the conditions under which the law not only can be used as a public health tool, but maybe it would be irresponsible not to use the law as a public health tool when we don't typically love it as a country. Big question.
Yeah, it's a huge question.
How much time you got?
Yeah, exactly. I love that, though. And so I think you are thinking about law very punitively. So I think you were saying law as like a don't do it or a penalty. I would also say a lot of what we think about is using laws as the positive. Like, what are the ways in which we can encourage a good behavior, which we can put systems in place for people to make the best choices possible. Right, like I said, I don't think some folks are not getting vaccinated for lots of different reasons, but some of them are cost, some of them are convenience, some of them are not getting their questions answered, some of them are not having access to a primary care doctor. So how do we think about using our law? Like, I just want to broaden our thought process about law, because I think there are some times where we have to use law as a stick, right, and say you must not, penalty, jail, whatever. But I think, again, drawing on my experience in North Carolina in COVID, the way our government is set up in North Carolina is a pretty weak executive. And what I mean by that, we basically didn't have a lot of punitive tools, basically until you get to jail. And you're like, all right, am I putting people in jail? No, we're not using that tool. So then it becomes a lot of influence as well as proactive tools that you can use, right? So what are the ways in which you can make it as easy as possible, to, like I said, to make the right decision and facilitate that? So not answering fully your question, and I do think there are times where you want to use the stick, and we need to, but I think there are other ways to use our tools. For example, smoking. Right, we know that that's not good for your health, and we, as we think about folks in Medicare, that we all contribute to, and do smokers need to pay a higher premium into Medicare as they get into it? I think that's a good debate. I would say, I don't know where I fall on that, because by the time you're 65, you've been smoking for a long time, and there are a lot of opportunities of choices that got you into to that point. And so being punitive at the end, is that the right choice? But those are the kinds of conversations I hear folks having, and I think right to continue to have. But I would think about using law as more of an investment tool to facilitate good choices for folks.
Jeff, we have time for one final question, not a statement in the
It'll be
form
a
of
short.
a question.
Oh no, this is a question, and it has conflict of interest because I'm Jeff Rosenzweig. I teach at business school at Emory, and want to ask about colleges and universities. Not Emory. We do get great benefit from CDC, but we have here college presidents. Lee Zach and Agnes Scott is rated #1 in the country for innovation. Dr. Professor Gale Spellman is rated #1 HBCU. But we also have in our group Brian Blake from Georgia State, president of Emory, Kennesaw State, and Georgia Tech. What can you do to make sure you're gaining everything you can from our colleges and universities? What can we do to make sure our students are gaining from you? There must be some more synergy we can create. As I say, we have it at Emory, but for all the others.
Well, great. I'm going to start, and then I'm going to let Deb jump in here. I think there is tremendous partnership between our academic institutions and CDC, and there's quite a good pipeline. And I know, Helene, we've been strengthening that, particularly with Spellman and others. Because as I mentioned the stat, 2/3 of folks at CDC have a master's or higher. And so making sure that we have trained experts is so critical. And folks like to live where they've trained and where they have that opportunity to see that career growth for them. So a lot of partnerships, but as I said, not everyone is master's and PhD. We still have a lot of ways in which we want to see that pipeline expand. But I would also say we have to divide and conquer. Like, you're not just educating students, you're also doing a ton of important research. And I think the visibility of knowing what folks are working on, what we're working on, again, so we're not duplicating effort and we're dividing and conquering on the research side is also really, really critical. But Deb, other thoughts you had?
Yeah, we actually did an announcement, I think it was today, there were 3 prevention research centers, all funded 3 different Georgia universities. It was Georgia State, Morehouse, and Emory. So that's an example right there of CDC as a partnership. We have work study at like 4 or 5 different Georgia universities now, so we get undergraduate level students. And we work really closely, like with Georgia Tech and Georgia State and Emory, really around a lot of AI and data, learning from them. Certainly you're doing a lot of work too with Spellman and other groups around when we're looking at some of the courses and social determinants of health. I see Rebecca, I'm thinking about the global health work that we're doing. So I would say we're pretty integrated, and I sit on the board of Georgia State's public health school, so really integrated there. So we always love to get students and fellows. We have a public health associates program where we get many people as graduates, and then we also know that we like to work with them as faculty and learn from those in the community as well.
And maybe I'll just end with back to the theme of trust in all of our institutions, right? I think academia is challenged at the moment, just like public health is. And how are we teaching the next generation to be critical thinkers in a moment when they are so overwhelmed by so much information, right? How are we really instilling in folks the ability to determine, yep, good information, not good information, in a world where there's just a sea of information and algorithms that may not promote all of the correct information? How do we create the next generation of critical thinkers? I think that's not going to just benefit CDC, public health, but almost every industry that I'm sure sitting here would need your support in that as well. Thank you.
Thank you for that question. And I know Dr. Cohen, as I said at the outset, is delivering the keynote at Agnes Scott's Women's Global Leadership Conference on October the 9th. So hopefully that will help spread the word. Before we thank you all for your time, I wanted to draw your attention to some upcoming programming after the theme of, what did you call it, good public health is good for business. After a couple of programs around that, we're returning to the political season, and next week's program with Judge Michael Luddig ought to be quite interesting. Dennis Lockhart is already prepared for that conversation, so please be ready for that. Dr. Cohen, I want you to know that we now know about the CDC, and we are proud of the CDC.
Thank you.
Thanks to members like Deb. Deb, thank you for putting this program together. You touched on a lot of themes that we've been talking around as a club, like mental wellness, and an ounce of prevention is better than the cure. October the 24th is World Polio Day. So you can count on us on educating everybody about what we've been able to accomplish broadly as Rotarians. So thank you for your time. Thank you for your leadership. I'll end off by saying that Doretta Rhodes would like us to embrace the race this afternoon up at the Battery. So let's do that. But let's thank our speakers today. Thank you so much.